Hi, and welcome to the Butler Buzz. I'm your host, Kate Stutz, and I'm here with Linda from the Community Health Clinic. Thank you for joining us, Linda. How are you?
Good. Thank you so much for having me.
Sure, of course. Well, we are all excited to see you, and we're just curious to know how has COVID-19 changed things at the Community Health Clinic?
Sure. Well, fortunately, we did not shut down through the whole, since the beginning of this, because we really felt that we needed to serve our patients. Our patients are ones that are stuck in the gaps. They don't typically have insurance, and they're over income for Medicaid, but they're working. So we needed to keep our folks working. So we didn't shut down during COVID. We did, however, we're a volunteers in medicine clinic. So we have one full-time staff. The rest, there are, 8 of us that are part-time, and the rest are volunteers. We have 80 plus volunteers that really run this clinic. So we let all of our volunteers go and, be off during that time. We just brought them back July 20th, I think it was, that we brought them back. So it was an interesting experiment for us, but we're pretty proud of ourselves because we kept care of our patients. I'm not saying we didn't leave any messes for our volunteers when they got back, but we stayed open the entire time.
I'm sure they were fine.
They were. There was some chuckles and some looks, but
Work.
we stayed open, and we're so thankful to have our volunteers back. It's really the life and the heart of the clinic, and it is our volunteers because they're what makes this work. We can't do it by ourselves. There's only 9 of us, and we cannot do this by ourselves.
Right, right. So can you tell us a little bit about your volunteers and what kind of services they provide to the community?
Sure. So we have a myriad of volunteers. We have doctors and nurses, dentists that volunteer, and these are local providers that live and work in this community. Excuse me. Dr. Maychek, for example, Dr. Shetter, Dr. Michelle, Dr. Amos. These are all practitioners that work in this community, and they give of their time to come here to the clinic and take care of patients at no charge. Dentists, we have Dr. McHugh, Dr. Todd, Dr. Pribel, Dr. Reed. They all give of their time here in the clinic, but they have their own work that they do in their own businesses. We have our volunteers that they do a lot of paperwork. We apply for prescription assistance through the pharmaceutical companies. We take care of patient financial records, their medical records. The volunteers do all that. They meet with our patients one-on-one. If they're, we have, I guess I should say we have case management volunteers that meet with our patients one-on-one. If they need our services, maybe they need other things. How is your, do you have food in the home? Do you have, do you have transportation to your work? Do you need clothing? Those types of things. So we always really try to know our whole patient.
So you're covering more than just medical needs for your patients.
Absolutely.
You're covering more bases than just, your typical doctor's visit.
Exactly.
That's awesome.
Thank you. Yeah. I think it's the volunteers that make that, and they're all here because they want to serve that passion that they have, and so I think that's what makes it work.
That is wonderful. That is so good to hear too. And with COVID going on, it has been so difficult for anyone to host any kind of fundraiser. So
Right.
Is there a way that we could help you? Is there anything that we can donate or give? Is there a way to safely volunteer to be like an additional volunteer? Is there anything we can do to help you?
Sure. Thank you for asking. We are a nonprofit. We have 2 big fundraisers a year that really provide about 25% of our total budget. we've had to cancel both those fundraisers this year. So that is going to be hard on us this year. So monetary donations are always welcome. You can make donations at our website. It's butlerhealthclinic.org. You click on the donation tab, and it just walks you through making a donation. I think because we are the community health clinic, a lot of people make donations of supplies, medical goods. Maybe somebody's passed away and they have excess, trach supplies or gauze and, diabetic supplies. We can take all that, and we do take that here. The only thing we don't take are medications, and we don't take beds. We just don't have the space to do that. But supplies are another one that we're always needing, even as much as, notepads and sticky notes and, the usable stuff that we use. Yeah, office supplies that we use every day, because we do have to raise every penny that we use. We don't charge anything. We don't accept any insurances. Our services are 100% free. So there's, other than our fundraising, on our local community database, what we make is what we use here to run the clinic. As far as volunteering, we're always accepting volunteers. It is time of COVID, but we are taking all kinds of necessary precautions between us and our volunteers. The volunteers that have come back because of choice. We have some that are still not back, and that's okay. When they feel safe, when they're comfortable, maybe they have, underlying health issues, but when they feel comfortable, then they'll come back as well. But if somebody is willing or wanting to volunteer, nurses, doctors, dentists, clerical, if you like to garden, we have our own garden here at the clinic. If you'd like to wash the windows, if
every little bit helps, right?
Every little bit helps. Every little bit helps.
Exactly.
A social media guru would be my biggest wish list. Would be mine. Okay. But so we always look for a job if somebody has that passion and they want to serve and they want to work with the community. We try to find a place for people.
Well, I'm sure that people will come together and you'll get some help.
Yeah, I hope so.
Well, Linda, thank you so much for your time and educating us on the community health clinic.
Sure. Kate, thank you for your time. I appreciate you, and hopefully we'll get to chat again.
Yes, definitely.
All right. You take care.
You too.
Bye-bye.
Right back with our next guest.
Hunger exists in every county in America. More than 1 in 5 children are at risk. Be a hero and help Armstrong avenge hunger in September. During this unique time, we're supporting our communities with the Avenge Hunger Virtual 5K. You can walk, run, or bike at your own pace throughout the entire month of September. All proceeds benefit food pantries and soup kitchens in your area. Sign up before September 23rd at armstrongonewire.com/breakingbread and help Armstrong support Avenge Hunger Month.
Hi, and welcome back. I'm here with Jessica Hagan of Grove City Pet Rescue. Jessica, how are you doing?
Hi, good. Thanks for having me.
Yeah, we're excited to hear about Grove City Pet Rescue. So can you tell us about your organization?
Yeah, so we're based obviously in Grove City, and the organization has been around for several years. We help try to promote responsible pet ownership through education, spay and neuter, encouraging folks to get their cats to the vet. And we also take in cats and kittens that need help finding homes. We try to help with TNR. And all this has been a little a little tricky this year with all the pandemic and different things, which I know everybody's dealing with. So we're learning how to do things a little differently this year.
Right, yeah. Right. Can you tell us about some of the changes that you've made since COVID has come around? I know it's been a lot of pivoting, a lot of changes, and it has all had to happen pretty quickly.
Yeah, so we're a tiny group. We only have, a couple dozen volunteers, and obviously most folks work full-time too, so they're doing this in their spare time. So we're only usually open to the public 1 day a week for a few hours. And since COVID has hit and we haven't been able to be open as normal, we've been trying to do a lot more adoptions, applications, and fundraising online. We are having an adoption event on September 19th. So in a couple weeks on Saturday. It is for a adult cat only. Folks that are interested in an adult cat,
Okay.
cats that are 12 months or older, and we have posts about that on our Facebook page. So anybody that's interested in adopting, we haven't been able to have folks in the adoption center, so we're doing a deep clean the weekend before this, this coming weekend, to get all that ready. So that's been one thing. We've been trying to do a lot more stuff online. We've also been doing most of our fundraising through our Facebook page. We have an Amazon wish list. We have a PayPal account if people want to make donations. And we've been doing raffles pretty much every week. So check out our Facebook page if you want to help out. The raffles are nice because you get a chance to win for every dollar you donate. You might win some cool stuff, and the bonus is you're helping cats.
Yeah, that's fantastic. That was so great that you were able to switch everything up and put it up all online. So that's just on your social media. People can go and just find everything that they would normally find in person.
Yep.
That's excellent. Is there any way that we can help you out at this time? The fundraisers are great, and what can we do to kind of help you guys out, or drop something off, or volunteer safely?
Yeah, great. Again, you can check out our Facebook page. We also have an email address that is just like our Facebook page, grovecityarea.petrescue@gmail.com. We always need folks to volunteer and help us clean the adoption center. There's folks in there. We try to pair people up so they can go in sets of two, clean the adoption center every day, and we schedule that around the time that you're available. We also need help with events. Some of the events we still can do in person. For example, once a month we participate in the farmers market in Old Town Grove City and do a bake sale. And that's going to be happening tomorrow, actually. So if you're around Grove City tomorrow between, I think it's 3 and 6, stop out Old Town Grove City and you can buy some baked goods and help some kitties. And then when we do get back into the swing of having regular events, we also need volunteers to help with those, manning tables or setting stuff up, passing out literature. We also could really use foster homes. I know sometimes kitten season around here is usually more in the spring and summer, so we're hoping that it's starting to be winding down. Fostering is a great way you can, learn how to take care of animals, teach your kids how to take care of animals. A lot of folks volunteer in the summer when their kids are home from school. And again, I know this year might be a little different. We might have some more kids home from school. And that's a great activity. Yeah, that's a great activity for kids that aren't quite old enough to drive and have a job, but are old enough to kind of have a little bit of autonomy and learn how to, have some responsibility at home. So any way you can volunteer is great, and we try to find a way that everybody can help. So for example, if you can't drive, we can still find a way. Maybe you can help write thank you notes or help us post stuff on social media. If you like to bake, again, we're doing bake sales and different events that way. If you're able to foster, great, we can get you set up. So we try to find something everybody can do. So no matter what your skill level or experience is, we can definitely find something to put you to work.
Oh, that sounds great. And there's so many good options, and we can always find a way to help. Okay.
Absolutely.
Yeah, great. Well, thank you so much for all the information, and good luck with everything.
Well, if we have 2 seconds, I just wanted to show you I have a special guest. This little guy's hanging out on a heated pad on my desk here.
Oh, it's so tiny.
This is Klondike. He's almost, you can see he's black and white like a little Klondike bar. He's almost 2 weeks old. And I kind of specialize in fostering the itty bitty kitties. So I take the little guys like these and feed them and help them go to the bathroom and get them healthy and get them big. And his eyes just decided to open over the weekend. You probably can't see on my crummy camera, but again, we're not gonna give you something you're not experienced with. Don't feel like, oh, I'm gonna foster. Here, take this tiny kitten. We give you something you're comfortable with, and work from there. But anybody can foster. Anybody can learn how to do it. If I can do it, trust me, anybody can learn how to do it.
Right. Oh, he's precious. Well, thank you for sharing Klondike with us.
Sure.
And thank you for sharing all your information with us and hanging out with us tonight.
Great. Thanks for having us.
We'll be right back with our next guest.
Armstrong.
I've been hearing a lot about the new Zoom experience.
Yep, Zoom now includes enhanced Wi-Fi, advanced security features, and complete control with the Plume app.
Okay. But can you cut off internet access to your kids' devices at the touch of a button when they won't get off their tablets and do their homework?
Yes, you can. Studying or working from home? Armstrong's new and enhanced Wi-Fi, supercharged by Plume, will keep you connected. Zoom, internet made easy.
Hi, and welcome back. I'm sitting here with Ken Klaus from Butler's Hope is Dope initiative. Ken, how are you?
Good, Kate. How you doing?
I'm good, thank you. Can you tell us a little update about what's going on with Hope is Dope in the midst of our pandemic?
Yeah, so just a little refresher for maybe somebody who's watching this who's never seen it before. Hope is Dope is Butler County Community College's response to the opioid epidemic that's been happening in our area and in the country. And it's based on a book entitled the same, Hope is Dope, which is written by Steve Troy, who's a licensed therapist down in Cranberry at Quantum Revolution Counseling. And so basically what Steve did was, over the course of hundreds of sessions with thousands of clients, he found what was working best for the clients that were improving, and he decided to write a book on that. So Butler County had found this book and thought it would be a great addition to the area. So, and as you know, we've been doing this for a couple years now, and it basically started out as free public classes to anybody who was interested, and then we would have our Hope Nights once a month, which was just a fun little event where people could actually experience some of the things you can do to rewire your brain for recovery. And then eventually, about a year ago, Butler County Community College had teamed up with the Center for Community Resources, and we took these classes to another level, and we started with them a program called SOAR, S-O-R. That stands for State Opioid Response. And then basically what we do is the Center for Community Resources will take on case management services and help anyone in need that can apply for this program find housing, get financial assistance for housing, and then they're welcome to come through the Hope is Dope program as well.
So you're like really covering a lot of what you can do within recovery.
Yeah. It starts out, so most people know that drugs alter the chemistry of the brain, and they manipulate brain chemistry, and that's how addiction forms and stuff. But what we're learning is that those changes aren't permanent. You can actually restructure and rewire your brain in various different ways. There's actually thousands of different ways you can do that. And so we basically walk people through, in simple terms, how that brain chemistry works. And then on top of that, we want to give them the actual experiences to try for themselves that can help rewire the brain. And so we've done everything from yoga, Reiki, meditation, art classes, eating healthy. I think we did a night where we did stand-up comedy and improv, and we actually got some of the audience members to join in, which was a blast. And then we do some other things too, like outdoor adventures, rock climbing. What else have we done? Canoeing, a whole bunch of stuff, life-size Angry Birds, all those little fun endorphin producing things that we just try and give everybody a taste of to see what they like.
Sure, definitely. And I think people, they gravitate towards that because you really need examples of how to do this. And, you could just say, well, just go do some artwork or take a yoga class, but you need that like a little bit of assistance and a little bit of help. And also when you have the community standing there with you, you don't feel alone. So it's easier for someone to take a yoga class that maybe has never taken a yoga class before. So
Yeah.
I think what you're really doing is you're actually providing more than a yoga class or more than a Reiki session. Like you're making it extremely comfortable and doable. So you're making this more attainable for people. And I think that's just fantastic.
Oh, thank you. Yeah. One of the things that makes it great is just that, they come in and it sounds good. Some of them might be reluctant to try it at first, but because we bring the experience to them, they are more likely to go out and try it themselves. And we have a bunch of great partners that we work with, everything from the YMCA to the Butler Art Center, Reiki practitioners in the area who come in, and they just make it a great community experience, which is so important to people in early recovery.
Yeah, definitely. So are you still hosting the classes at like the Butler Art Center?
It is at the Art Center, yeah. Yeah, yeah. So basically what we do is we have 10-week cohorts, and our next one is getting ready to start sometime in October. Um, we don't have that date locked in yet, but it is sometime in October.
Okay.
Um, so yeah, it's at the Butler Art Center.
Are there different
Actually,
things going on with the COVID restrictions?
we're pretty much following the standard protocol. So, we ask people to wear masks. We have sanitizing stations available. And then we have our stations socially distanced, so everyone has at least 6 feet or more. So, yeah, it's actually in that beautiful space, the art center. There's plenty of room to be able to do that, and it doesn't really affect our
It is
class.
really spacious, definitely.
Yeah, yeah, it's beautiful down there.
So can you tell me how we can help you out during the pandemic? A lot of people have lost, the ability to have volunteers or fundraisers. How can we help you guys out right now?
Yeah, so well, basically we just want to get the word out because as you know, this the COVID pandemic has affected people in more ways than one, more than just the economy, and the people who've struggled with either mental health issues or substance abuse issues have they've gotten a lot, they've lost a lot from this. A lot of people have relapsed, and so finding the way back to recovery. We're just trying to get the word out that we have this available. So yeah, anything we can do to pass the word along.
Sure, sure. Well, I mean, you provide a lot to people and we're grateful. So thank you for doing all that and all your hard work with it.
I appreciate it. Yeah.
Great, Ken. Well, thank you so much for being with us tonight, and it's good to see you doing well.
You too, Kate. Thank you.
Great. We'll be right back with our next guest. Hi, and welcome back. I'm sitting here with Stacy, the program manager at Early Intervention. Stacy, how are you?
I'm well. How are you?
Good, thank you. It's great to have you on, and we'd love to learn about early intervention and what you provide to the community. So can you tell us a little bit about early intervention and what you do there?
Sure. So we are a free program in Butler County for children birth to 3. What we do, we get referrals from anywhere, pediatricians, the NICU, daycares. A parent can refer themselves. And it's if there's any concern in any of the developmental areas for their kiddo. And what we do is we complete developmental evaluations to determine if there is a delay of a 25% delay or more compared to typical children their age. And if there is, we provide free therapy. Typically in the home. During COVID right now, we're doing everything virtually via teletherapy, hoping we return back to in the home once all of this passes. But the goal, we come up with a goal with the family. We're working with the therapists are coaching the parents to just help their kiddo catch up, get to where they should be for their age. And yeah.
It's a fantastic program. I even used early intervention for my son. He had like a little bit of a speech delay, and the therapists that came into the home were so helpful, and they were so loving, and everybody's just very open-minded, and it was just a wonderful experience. So I think that if you even have just a little bit of concern for your child, you should definitely at least rule it out. I loved everything about the early intervention. It was so helpful for him, and now he's thriving. Yeah, it worked out really good. So can you tell us a little bit about how you would go about admitting your child, or if you wanted to, sign up yourself, how would you do that?
Sure. So you can talk to your pediatrician and just, tell them where your concerns are. Like I said, we cover 5 areas of development. So if you have any concerns in communication, Cognitive, like early learning skills, physical development, adaptive, which are self-help, so feeding, that falls under that area, and then social emotional. So if you have any concerns, I recommend you talk to your pediatrician, but you don't have to. You can just call our information referral phone number with CCR, Center for Community Resources, and we can come out and like I said, do the evaluation. We also have screenings. So if you're not sure and you just kind of want to do a quick snapshot, we use a screening questionnaire to kind of give you an idea. Like, do I want to go into full in-depth evaluation, or do I feel good at where my child is developmentally?
Okay. And what does that look like now that we have COVID going on? Is everything kind of over Skype or over Zoom, or are you able to have people in like small groups at sometimes?
So right now we start virtually. So our intakes with our service coordinators are via Microsoft Teams. Our evaluations are over Zoom or Teams, something like that. And we are starting therapy via virtual. However, that can change if there's a need. If there's a need to address a specific outcome, even intermittently, with all the rules, following the correct protocol, then we can discuss doing a couple face-to-face visits.
If a parent has a child that they're a little bit concerned with, what would be the best way to go about contacting you for services?
Yeah, so they can call our information referral phone number. It is 724-431-3748. And they'll gather information about your child, and they'll connect them with our early intervention service coordinators.
Well, that sounds fantastic. This has all been such good information, and I know necessary for, some parents and kids to, learn about. So thank you so much for joining us.
Thank you for having me.
We'll see you next time on the Butler Buzz. Hey there, Butler. If you want to see more from the Butler Buzz, click on the playlist button up here. To see other Armstrong local programming shows, you can click the subscribe button down here. I suggest you do both. Thanks for watching. We'll see you next time.